Hey everyone, this is Dr. Scott Gray coming to you from scottgraypt.com. So the other day I told you about how I'm suffering with hip impingement on my left side. So today I wanted to kind of show you, how to rehabilitate that, how to train around it, and activity modifications that your patients need to make in order to let that hip settle down and potentially return to prior level of function. So one of the biggest things that you need to do to help your patients let that hip settle down is modify their sitting posture. So when you sit, you go into obviously hip flexion, and that's usually what causes the FAI. So you want to modify the depth of the sitting. So one thing that I've been using when I'm treating is I've been using a higher box or stool when I'm treating patients. So I don't sit in these low chairs. Similarly with your patients, you don't want them to sit down in a chair where their butt is lower than their knees. So ideally, in a perfect world, the feet be flat on the floor and their butt's higher than their legs. So even when they're driving to work, whatever, they need to make adjustments or change the position of their pelvis. And in order to do that, you gotta adjust to seating height. So the second thing you need to do is make activity modifications to their sport or function. So if you have a golfer, for instance, and I have FAI on my right hip, if I bring my golf club back, I'm gonna flex, adduct, and rotate, which is probably not gonna like that motion in this right hip. So what you need to do is kind of have your patient compensate by toeing out, which allows them to still internally rotate, but they don't go to the extreme ranges. Similarly, if you're working with a CrossFit athlete and they get that pain when they're deadlifting or they're squatting, you need to modify their stance a little bit. So you gotta play around with that for a little while to find what works for them, but typically you wanna kind of do more external rotation and a wider base stance. So the closer I get in, the more I'm gonna probably impinge on that hip. So those are just some simple modifications that you need to make with their sport or function to help that hip settle down. So the next thing you need to do from a physical therapy standpoint is you need to mobilize this hip or work on the impairments. And so the common things that you'll see with FAI is patients that they're always stuck in this anterior pelvic tilt. And so their hips are always flexed and they can't really get out of it, they can't extend their hips. So they're always kind of rubbing up against that acetabulum. And so we want to kind of just bring the pelvis back to neutral and also work on some hip extension and core strength. So we're going to work on some of that here. So typically you can do just our general hip flexion mobilizations. You can get in there with your hands if you need to work on some of the psoas and rectum and all that. But you basically just want them to do half kneeling, reaches and arm drivers, kind of get that hip to extend. The second thing you want to do is work on some core stability exercises. So I'm just going to use this TRX. There's a thousand different ways you can do it. And so I'm just going to work on my hips extended and reaching out to a fallout to work on some of that anti-extension and my core strength. So again, obviously you can progress core strength 1,000 different ways, but that's just one option. The third thing you want to do is work on mobilizing and distracting that hip. So I've got a band here. I'm just going to wrap it around my leg. And from here, I'm just going to let it distract my hip, and I can kind of pull my hip up with the pelvis, which is going to further elongate and distract the hip. And obviously if you have a manual therapist, you can have them do it, but this is just some self ways. And then the final way, real quick, is you can work on that hip flexion pattern by taking your same band and kind of going close to the joint line. And then from here, I'm going to laterally distract my hip. And now here, I can do some flexion activities. So if I don't have this band on me, my hip gets achy, but this gives me enough space to clear my femoral head and my acetabulum, and I'm able to actually train a little bit of flexion. So do me a huge favor, try these strategies with your patients, and let me know how it goes.